I want to ask you something. If a doctor has ever looked at your child, at the snoring, the mouth breathing, the crowded teeth, the meltdowns, the dark circles, or the sleep that never seems to actually help, and they told you, wait and see, I want to ask you, wait for what? See what? What exactly is supposed to change on its own? Because in my practice, I work with families every single week who waited, who followed that advice, who trusted it, who pushed down the instinct in their gut that said something is not right, and waited. And what I see when those families finally come through my door is not a problem that's resolved. It's a problem that compounded. So, this episode is about why that happens and what to do instead. I'm Chelcie. I'm a myofunctional therapist and the founder of Breathing into Life Myofunctional Therapy. And I want to say something clearly before we go any further. I am not here to vilify pediatricians. I work alongside physicians, dentists, ENTs, and speech therapists regularly. Most providers giving this advice are doing their absolute best within a system that was not designed to catch what I am trained to catch. This is not about blame, but this is about information. Because wait and see, no matter how kindly it is delivered, is not a neutral recommendation. It is a decision, and that decision has consequences. So today, I want to walk you through exactly what those consequences look like so that you can make an informed choice the next time someone tells you to wait. So why does this matter? Wait and see is one of the most common things families hear across pediatric healthcare, from pediatricians, from dentists, ENTs, speech therapists, orthodontists, and it comes from a reasonable place that nobody wants to overtreat a child. Nobody wants to put a kid through interventions they don't need, and that's instinct to be conservative, to watch and wait. That is not wrong. But there is a critical difference between a concern that genuinely resolves with time and a functional pattern that compounds with time. And the signs that I look for every single day: mouth breathing, tongue dysfunction, sleep disorder breathing, poor oral posture, these do not self-resolve. They do not get better because the child got older. They get more entrenched, more structural, more expensive to address. What most people don't realize is that childhood development has windows. Windows when the jaw is most responsive, windows when the breathing pattern is most changeable, and windows when the oral habits are most easily retrained. And what we also know is that windows close. I want to speak directly to some of you right now. The mama who was told her child would grow out of the snoring, the mama who was told to wait until all the adult teeth are in before worrying about the crowding, or the mama who was told the tongue tie really doesn't need treatment. Maybe the mama who's been in and out of the pediatrician's office for years with the same concerns and keeps leaving with the same answers. You are not wrong to keep pushing. You are not being an anxious mama. You are not overreacting. You were reading your child correctly. And this episode is going to show you exactly why. So let's talk about point one, that development has windows, and we all know that windows close. Let's start with the foundational piece because everything else builds on this. The craniofacial skeleton, the airway, the oral motor system, all of these develop on a timeline. And the research is clear that there are specific windows when intervention is most effective, least invasive, and produces the strongest outcomes. Birth to age 3 and the earliest and the most responsive window. The oral system is brand new. Habits are newest. The structures are most malleable. Ages 4 to 10, the next critical window. The jaw is still growing. The palate is still responsive. Functional patterns can still redirect development. Now, pre-puberty, the last major window for structural influence. After this, the bones are largely set. Intervention is still possible. We see it happen, but it's more complex, more invasive, and less efficient. Now, here's what I need you to sit with. Every month inside one of those windows that passes without addressing the underlying issue is a month of development happening in the wrong direction. The jaw that narrows a little bit more, the breathing pattern that becomes a little more habitual, the oral posture that gets a little more entrenched, and the sleep disruption that accumulates a little more cost on a brain that is still developing. Waiting does not pause the clock. It lets the clock run in the wrong direction. Let's move on to point number 2, the compounding cost, what waiting actually produces. And I want to make this concrete because developmental consequences can sound abstract. So let me walk you through what I actually see. In breathing, a child who begins mouth breathing as a habit eventually becomes a child whom nasal breathing is genuinely harder because the jaw has narrowed, the palate has risen, the nasal airway above it has shrunk. The habit became the structure. And now addressing the breathing requires addressing both the habit and the anatomy. In sleep disorder breathing that goes unaddressed creates cumulative sleep debt. Night after night after night, the child is not cycling through the deep restorative sleep stages their brain needs to consolidate learning, regulate emotion, clear metabolic waste. And that cost shows up during the day in focus, in behavior, in emotional regulation, in learning, and years of that accumulation in ways that are not fully reversible. In orthodontics, the child who is told to wait for braces is the child whose jaw spends those waiting years developing in a compromised position. By the time treatment begins, what could have been addressed with myofunctional therapy and early functional intervention is now a complex orthodontic case, possibly requiring extractions, possibly requiring jaw surgery, almost certainly costing significantly more in time, money, and discomfort. In speech, the compensatory patterns that form early become more entrenched with every passing year. The child who could have been retrained at 4 is harder to retrain at 9. Not impossible, but harder. And the window where it was easiest is gone. So waiting is not free. It has a price, and children pay it. Let's talk about point number 3 on why this advice keeps getting recommended. And I want to spend a few minutes here because I think this is important. The providers giving this advice in most cases are not dismissing you. They are not being careless. They are working within a system that was designed to identify acute problems, infections, injuries, developmental delays that fall outside clear diagnostic criteria. It was not designed to identify the functional developmental patterns that I look for every single day. Myofunctional development is not part of standard pediatric training. Airway assessment, the kind that looks at how a child breathes, where their tongue rests, how their jaw is developing in relation to their breathing pattern, that is not part of a standard well child visit. Your pediatrician is not looking for these things, not because they don't care, but because nobody trained them to. And the result is that functional patterns that are visible and addressable, they go unidentified until they become structural problems that are harder and more expensive to fix. So this is not about distrust. This is not about walking into your next appointment with a mindset that's already upset. It's about understanding what your child's regular providers are and are not equipped to assess, and knowing when to seek a different kind of evaluation. So, point 4, how to know when to stop waiting. So, how do you know? How do you know when wait and see is not the right answer for your child? I want to give you a clear list. If your child snores, any snoring in a child is worth evaluating, not monitoring, evaluating. Snoring in a child is not normal. It is a sign that the airway is partially obstructed during sleep. That is information that deserves a functional assessment, not a wait and see plan. If your child breathes through their mouth at rest and during sleep, mouth breathing is not a personality trait. It is not just how some kids are built. It is a sign that nasal breathing is not happening the way it should, and that deserves to be looked at. If your child's jaw or palate appears narrow, if the roof of the mouth has that high cathedral ceiling shape, that is a sign that the tongue has not been doing its developmental job, and the jaw has been developing without the forces it needs. If your child has been in speech therapy without significant progress, speech therapy addresses articulation and language. It does not address the underlying oral motor and tongue function issues that may be driving the speech patterns. If progress has stalled, a myofunctional evaluation is a meaningful next step. And if your child's behavior, focus, or emotional regulation are a significant concern and nothing is working, I want you to ask whether the airway has been evaluated, because the behavioral picture of a child who is not getting restorative sleep and adequate oxygen looks almost identical to ADHD, and almost nobody checks the airway first. If your child had a tongue tie revision without pre or post myofunctional therapy, the revision is only one step. The therapy is just as important of another step. And this is the step that most families never get to. And if you have been told to wait and see, and your gut keeps saying that that is not the right answer, I want you to trust that instinct. Your instinct about your child is clinical data, and it deserves to be taken seriously. So here's what I want you to do. If you have been told to wait and see, seek a second opinion from an airway focused provider, not instead of your pediatrician, in addition to. If your child has any of the signs I just walked through, do not wait for your next well child visit to bring it up. Seek a functional evaluation now. And if you're not sure, if you are sitting here thinking, I don't know if what I'm seeing is significant enough, that uncertainty is reason to get evaluated, not reason to wait. Here's the thing I want to leave you with. The best case scenario of getting a functional evaluation is that you were told everything is developing well and you leave with a peace of mind. The worst case scenario of not getting one is that you miss a window that you cannot get back. There is no downside to knowing. So if you want to understand what a functional evaluation actually looks like, what to ask for, who to see, what the process involves, I have a free webinar that I put together that walks you through all of it, and this is the place to start. I want to close by saying something to the mama who's been fighting for her child in waiting rooms for months or years, that you were right. The instinct you had and have, the one you were told was anxiety, was overthinking, was just being a worried mama, that instinct was and is accurate. The system just was not designed to confirm what you were already seeing. So this free webinar I created, it's for you, and it walks you through the full picture, the breathing, the oral function, the development, the sleep, and it shows you what is actually possible when intervention happens at the right time. It's free, it's thorough, and I think for a lot of mamas, it's going to feel like permission to stop waiting, permission to trust what you have known all along. So the link is below in the description, in the show notes, and I cannot wait to see you there.